Hello family, I'm so glad to have you back. Welcome to another informative video. So kinse ke ribala babana, and I'm like ke December. So ka itse ka December ra tswa di out go monate re ja joy. Mara one thing for sure, we don't want go ja joy and then re boe gae ka di bundle of joy. Nemvula yini gute bo makabishi bo ma spinach. So January is not a good time to be having stress about bundle of joy. So this one is for you ladies. So let's talk about Intra Uterine Device, which is basically a device that is inserted in the uterus cavity, and it helps with preventing pregnancy. So what am I talking about? I'm talking about something that looks like this. So the Nova T380 is basically an intrauterine device which is embedded with copper. So the copper is what helps us to prevent pregnancy. So how does it do that? It basically is a very toxic substance for the egg. Remember, during your menstrual cycle there's an egg that is produced and it needs to move all the way through till it reaches the uterine cavity, right? So this Nova T380 copper, it actually is toxic for the egg. It leads to a point where the egg doesn't develop fully or grow enough, and sometimes it can even get ingested, so that's how then it helps to prevent pregnancy from occurring. Okay, so you can get, this is not the actual device, it's not as big as this is just the packaging of it by this particular company. All right, so it is available for purchasing at private institutions, but it actually has that S there. So the moment it has the S and a number, that square thing there, so it starts from S0 all the way to 7. It's what we call schedules. The moment is above 2, it means you will need a prescription for it. Yeah? So this one is an S4, which is a schedule 4. It will need a prescription in order for you to purchase it at a private institution, and also it can only be inserted by a trained healthcare professional. It's one of those you cannot do it at home. So unlike other contraceptives like condoms where you can insert them yourself, this one you cannot insert it yourself. It needs to be inserted by a trained healthcare professional, be it a doctor or a nurse, and it costs from 2,000 rand and above, and that doesn't include the cost for the insertion procedure. So it doesn't include that. So that cost on its own, it has its own amount. However, in government we've got you. So this is basically for free. In government it's available, in public institution it's available for free. So you'll just have to go there, be seen by a doctor, they examine if you're suitable for use, and you are good to go, right? So if you do then decide to go get it, and you need to now just be very vigilant and check if the packaging is not broken or the seal is not open, right? And then it looks something like this. It will be inside this, right? So you need to check if that also is not broken and it's still in perfect condition, because if it's broken or open like that, it can introduce some bacteria and it shouldn't be used, right? So what does the device look like? So it's something like this. So something like that, and the Nova T380 is this thing inside the tube. So this is a tube, it's an insertion tube, right? And that's a flange, and this is a plunger. So the trained healthcare professional will know what to do, but I just quickly want to show you how they do it. So they'll examine your uterus and make sure that it's safe for insertion and you're good to go, and they will measure up till there in centimeters of how far they should insert it. And let me show you, and then it has something like this. You see, it's very faint, very tiny. These are called expulsion thread. So it's basically what we will use to pull out the intrauterine device in the case whereby you'd like to remove it. So it's pulled out, it's still pulled out or expelled from the uterus by a trained healthcare professional, not yourself. And then also, so this is what they do, right? They use the plunger to push it up. So I just want you to see where the copper is embedded. So they push it up like that. See that? And that's basically where your copper is. So you see that is the copper over there that is helping you. And they will cut it so it will sit like this in the uterus. It will be sitting like this. So the T is basically helping it as arms, so it stays in place, right? And the thread will be cut out just enough in the cervix, so that just enough all the way to the cervix, so you'll be able to examine, to check every now and then if it's still in place, right? So what I like about this contraceptive method is that unlike the condoms, unlike the pills where you can just forget and the next thing you are pregnant, is that it stays in place and it's effective for a period of 5 years. So for 5 years you don't have to worry about getting pregnant, right? The other lovely thing is that if it's properly in place, you don't actually have to stress about breastfeeding. If you're breastfeeding, you don't have to worry. It doesn't get transferred into the breast milk and therefore affecting your child. So there's no such thing. And also, you saw those thread that we use for expulsion. So in the case whereby you have been checking and you are now well trained to check if it's still in place and you can't find them, they are missing, right? They can be traceable by ultrasound scan or an x-ray scan. So if they are missing, then we will be able to check. And also the ultrasound or the x-ray will be able to ascertain the position of the intrauterine device, because it's very much important to see if the device is still in place and not partially partially moved or so. So you definitely need a gentleman, guys. You ladies, you definitely need a gentleman when you are using this method of contraception. And the other thing is, most of the other contraceptives, they have medicines which are contraindicated, which basically means that you shouldn't use those medication if you are using this birth control, right? Or you would have to increase the dose of that medication and take more pills or take less pills. So with this Nova T380, you don't have to worry about that. No medication is contraindicated. So whatever medication you're taking, you are good to go to actually use this this device, right? So now let's talk about the side effects, because to be honest, this is man-made, so there's always side effects to each and every thing that you use, right? So the first thing is that within the first 4 to 12 weeks of inserting of the doctor or the healthcare professional has inserted this device, you need to go back for examinations just so they can see that it's still in place. The other problem with it is that if you are having rough activity, it can be expelled and you wouldn't even notice, and the moment is expelled without you noticing, fertility is restored, so you can fall pregnant shortly after that, if it's mid your cycle and it got expelled without you noticing, right? And the other thing is that for patients that have conditions such as epilepsy, those with fits and things, so if you are interested in this device, it might precipitate fainting. So you might have it might precipitate fainting or seizures for you. So it's one of those I wouldn't recommend if you're struggling with epilepsy. So if you're struggling from the pelvic inflammatory diseases, it also increases the risk of having an ectopic pregnancy. And if you maybe had them before, we wouldn't suggest that you go for this intrauterine device, right? Because it's not suitable for you. And then, like any other medication, you can actually be allergic to copper, right? So if you are allergic to copper, you will experience skin reaction, allergic reaction towards the copper, and unfortunately it would have to be removed immediately if you are experiencing that. The other thing is that it is a good contraceptive, especially after birth, right? However, it cannot be inserted in less than 36 weeks postpartum. So it cannot, because it increases the chances of sepsis, it increases the risks of actually it not working effectively for. However, this is definitely one of the best contraceptives you can use, because it's long term, and after you've inserted it, after a year, you only go to the doctor annually. So unlike the injections where you have to go every 2 months, unlike the pills where you have to take them on a daily basis and go get them on a monthly basis, when it comes to the copper uterine device, intrauterine device, you only go for doctor's examination within 4 to 12 weeks of insertion. If it's in place, after that, you basically go to see the doctor on a yearly basis for that period of 5 years, and you are good to go. So insertion of a foreign object, which is the intrauterine device, into the uterus will result in some sort of discomfort, pain, and also bleeding. And in an unfortunate case, it can result in perforation of the uterus or perforation of the uterine cavity. Now, should that happen, it needs to be removed immediately. And it also causes anemia, bleeding, or increased bleeding when you're spotting, and also increases the risks of having pelvic inflammatory diseases. So if you're already struggling from anemia, you're already struggling from pelvic inflammatory diseases, or you've just had a current pelvic surgery, an intrauterine device, this one embedded with copper, is not suitable for use as a contraceptive method. Let's say you've just had termination of pregnancy within 3 months. So termination of pregnancy is abortion within 3 months. You are not suitable for using the copper intrauterine device as a contraceptive, because your uterine cavity is not yet back to normal, so to say. So it hasn't fully recovered, so it's not suitable for use for you. If you are somebody that is susceptible to urinary tract infections, UTIs, so if you are susceptible to UTIs, or you've been struggling from infections of the cervix, or you just have undiagnosed cervix issues, you are not suitable for using this birth control method. If you are struggling with coagulation disorders, so these are the conditions whereby, for an example, you're taking medications such as warfarin. So if you know that you're taking warfarin, or you are taking clopidogrel, so if you're taking those medications, it means that you're definitely struggling with coagulation condition, and therefore it is not suitable for you to use the copper embedded intrauterine device. Okay. If you're also struggling from conditions such as fibroids or postpartum endometritis, you are not suitable for using this, or any abnormalities of the uterine cavity, then you shouldn't be using an intrauterine device, this copper intrauterine device. Now, when it comes to birth control methods, there is a lot of myths surrounding them. All right, there's a lot of myths surrounding them. One myth that is actually not true when it comes to this long-term method of birth control, because remember I said it is effective if it's in place and not shifted or moved for a period of 5 years. It is very effective. So one myth that people say is that the long-term use of contraceptives results in infertility. That is not true with this one. So what basically happens here is that the moment you remove this intrauterine device, your fertility is promptly restored. So what that basically means is that should the intrauterine device be removed mid your cycle and you decide to engage right in sexual activity without using any other contraceptive method, be it a condom, you will definitely be holding your bundle of joy in the next 9 months. Okay, thank you so much, guys. I appreciate you so much, and should you have any questions, don't forget to just drop them below the video. I'll be sure to answer every question that you might have. Thank you so much. Don't forget to like, subscribe and share. I'll see you in the next video.